Good morning. I'm Rachel Stephen-Smith. I'm the ACT Minister for Health, and I'm here with the Chief Health Officer, Dr. Karen Coleman, to provide the COVID-19 update for the ACT today. So today we have 33 new cases. 28 are linked to current exposure sites or are identified close contacts. 5 are under early investigation. 6 were in quarantine during their entire infectious period. At least 14 spent part of their infectious period in the community and may present some risk of transmission. 14 people are hospitalised, with 5 in intensive care and 3 requiring ventilation. Dr. Coleman will provide an update on how the current outbreak is developing in the ACT. Yesterday, there were more than 2,500 tests conducted, which again is strong for a public holiday. So thank you again to all of those people who continue to come forward and get tested, and please a reminder to do so if you have any symptoms of COVID-19, which of course includes fever, cough, runny nose, sore throat, and some of the other symptoms that we know are available on the COVID-19 website. And these continue to evolve, so please check the COVID-19 website. Yesterday, ACT Policing conducted 106 in-person compliance checks of homes, hotels and businesses. 1,310 drivers, they stopped to speak with them about the current health orders, and 22 people were directed to leave the ACT. 3 infringement notices were issued and no cautions. In regard to vaccination, our vaccination rollout continues at an excellent pace. We've now passed 94% of Canberrans 12 and over, having had 1 dose of vaccination, and more than 65% are fully vaccinated. As the Chief Minister has mentioned recently, and particularly yesterday, there are now appointments available at ACT government clinics today. There are multiple vaccinations options available to people in the ACT through GPs and pharmacies as well. So if you've got an appointment that is some distance off and you want to bring it forward, now is your opportunity to get vaccinated as quickly as possible. Today, I also like to provide an update on how the ACT government is working towards requiring workers in certain healthcare settings to be fully vaccinated against COVID-19. As restrictions are eased, we expect there will be increased cases of COVID-19 in our community, which will likely mean more people in hospital and, unfortunately, potentially more people in the intensive care unit. We know that healthcare settings in other jurisdictions have been particularly vulnerable to outbreaks. Healthcare workers have higher rates of potential exposure to COVID-19 as they provide care to COVID-19 patients and to those who may have COVID and be unaware of it and present to healthcare settings for other reasons. Vaccinating healthcare workers is the most effective way to protect them against the virus, while also reducing the transmission to patients, other staff and the wider community. The mandatory vaccination requirements will be implemented through a new public health direction signed by the Chief Health Officer. This will be focused on staff who have the highest risk of coming into contact with COVID-19 positive people. Frontline healthcare workers in hospitals, in any healthcare facility operated by Canberra Health Services, in a day hospital defined as a facility where a person is admitted for surgical or medical treatment and discharged on the same day, in a hospice, and also covering ambulance services and other patient transport. Consultation is now underway, commenced this morning, with the healthcare workforce and other key stakeholders to finalise the detail of the public health direction. Of course, a lot of work has already taken place over the past several months to ensure our vaccination coverage in high-risk settings such as our hospitals is high. Making vaccination mandatory in these settings is an added layer of protection for workers, patients and the community. The current proposal is that workers must have at least one dose of vaccine by no later than 29th of October and a second dose by no later than the 1st of December. In the coming months and weeks, we will consider a further phased approach to other healthcare settings in line with the recommendations from the Australian Health Protection Principal Committee, which were released last Friday, the 1st of October. So I'd like to again thank Canberra's healthcare workers who attend high-risk settings every day to care for patients and their families. Thank you for the work you do, and please, if you are not already vaccinated, please come forward. There are plenty of priority appointments available for you. And if you want to participate in the consultation, please do that either directly or through your industrial representative. So in summary, for those who joined late, we have 33 new cases today. 28 are linked to current exposure sites or are identified close contacts. 5 are under early investigation. 6 were in quarantine during their entire infectious period. At least 14 spent part of their infectious period in the community and may present some risk of transmission. And 14 people are hospitalised, with 5 in intensive care and 3 requiring ventilation. I'll hand over to Dr. Coleman to provide an update on the epidemiology of the current outbreak.
Good morning, everybody, and thank you very much, Minister. So on today's numbers, we have 33 new COVID-19 cases that have been notified since our last update. This brings our total cases to 1,038, with the total number of recovered cases being 949. We currently have 384 active cases. So of the new cases today, of the total 33, 28 can be linked to known cases or ongoing clusters, with 5 still under investigation. And of the 28 that are linked, 18 of these are household contacts. Of the total 33, 6 were in quarantine during their whole infectious period. And for a further 13, while they did spend some time in the community, we have assessed that they have posed minimal risk of transmission. So actually in today's figures, 14 people spent some time in the community for at least part of their infectious period and may present a risk of transmission to others. So going forward, we are going to be changing our reporting a little bit as we come out of lockdown and further easing of restrictions, and I'll talk to this a little bit more later. To 8 p.m. last night, we had 14 people in our hospitals, our youngest in their 20s and our oldest in their 60s. 10 of these are unvaccinated and 4 partially with 1 dose. 5 people are in ICU, ranging in age from their 20s to their 50s, and 3 of these requiring ventilation. So I'm going to move on now to our overview of the outbreak for this week. And as we've talked about, we do expect to see larger daily case numbers, and we will need to accept a degree of transmission in the ACT. This is inevitable due to a number of things, but mostly due to the highly contagious nature of the Delta strain, combined with more people moving around in the community as we ease restrictions. But as you know, increasing vaccination levels is what will temper this spread for us. So like all jurisdictions, we are analysing our data and processes to assess what will need to change to support our response moving forward. We're actually currently considering and trialling a number of new processes, learning from national and international experience about what works and what doesn't, and continuing our analysis of our current approach to risk in the community. As we've talked about, we have always taken a very conservative approach to risk, which has allowed us to maintain a relatively stable number of cases and form a really comprehensive understanding of the effect that our public health measures are having on minimising the spread in the ACT. And what our information has shown us is that when we continue to do the right thing and we take appropriate precautions, like wearing a suitable mask, physical distancing, and using hand sanitisers, that transmission is much less likely to occur. So you will recall in the case number overview today, I mentioned that those in quarantine for their whole infectious period, and then a further 13 cases, these 13 cases fall into this category. So moving forward, we will be focusing our reporting on only those that may pose a risk of transmission to others in the community, not those that we further assess pose a limited or very low level of risk. As a smaller jurisdiction, we've actually been really fortunate to be able to take this approach, and it means that now we are comfortable to adapt our reporting to focus on these higher risk cases in our community. Once this overall work is complete, I can come back to you with some more updates on the outcomes of that work and what this will mean for the community moving forward and how we transition through those changes as everything else transitions on our pathway forward. But back to the outbreak summary. This week we actually have seen a large increase in our case numbers. We had a new record number of cases in a 24-hour period, being 52, and then this was equalled 24 hours later. These larger numbers have meant that the average number of cases notified per week has now increased to 132 from 123.5 previously. This week also saw that the proportion of tests that become positive has actually increased from around 0.7% of tests to almost 2%. What this helps to tell us that there is actually a true increase in cases, and it's not just due to potentially an increase in testing. So this is real. We have seen more cases over the last week. But there are some things we know about these cases. Approximately 70% of these cases in the last week presented for testing due to being a close or household contact, which is actually really reassuring. Furthermore, we identified several clusters during the week where transmission did occur, and so the close contacts tested positive in the same week as the case when they're identified. So what this is suggesting is that more recently, cases have transmitted the virus to more close or household contacts. We are detecting that, and this may reflect our slightly relaxed social conditions and increasing movement in community or household visits. We know that more mixing and movement means more cases, but the important thing is that we are detecting them, and it actually indicates to us that our TTIQ, or our test, trace, quarantine and isolation measures, are actually working, because we're picking up these people in quarantine and they are reducing the risk of transmission to community. So overall, back to the overall outbreak, just over half of our cases are male, and the median age of cases remains at 28 years, with the age breakdown across the outbreak remaining largely unchanged across the entire outbreak, with the majority, about 53%, being between 18 and 44 years of age. Across the total outbreak, we have had a total of 95 people admitted across our hospitals. This is 95 people, makes it 9% of all of our cases have been admitted to hospital. Of these 95 people admitted to hospital, 16 have required intensive care unit admission, which is 17% of our hospitalisations were in ICU. And then of our 16 in ICU, 8 of those have required ventilatory support. Additionally, of the total 95 cases admitted to hospital, we know that the vast majority of those are unvaccinated or partially vaccinated. So unvaccinated, 68, which is a percent of 71.6%. Partially vaccinated with one dose, 16 at 16.8%. 5 were fully vaccinated at 5.3%. And then there's a further 6 cases, or 6.3%, which we are still trying to validate their vaccination status. So I guess this just continues to highlight for me, and for hopefully all of you, the importance of getting vaccinated as soon as you are eligible. We know that the vast majority of cases in this stage, 88%, are not fully vaccinated. So of the total outbreak, we now have over 80 cases where the contact or source is unknown, and more than 50 cases where the likely source is still under investigation, and these will be our newer cases. While these were a really big focus for us at the start of the outbreak, because we were really trying to stop in its tracks very early on, this will continue to become less and less important as we move through. As we move to lift restrictions, these cases will become more common, and it will actually become impossible to trace all chains of transmission. So how we actually track and investigate these are part of our current considerations moving forward, and about where we need to focus our effort to protect the more vulnerable or unvaccinated community members moving forward. There have now been 38 separate clusters identified since the 12th of August. These continue to be in similar settings and include essential worker activities, and we talk about these every couple of days. Unfortunately, we do continue to see delays in cases getting tested after developing symptoms. And I know we've talked about this several times, but the proportion of cases waiting 2 or more days from developing symptoms to getting tested is still around 40%. And those waiting 5 or more days is still 10%. So 1 in 10 cases we diagnose is waiting 5 days with symptoms. But alarmingly, in the last week, there were some cases where the delay from symptom onset, so the first presence of symptoms, to getting tested was between 10 and 13 days. These statistics are going in the wrong direction. I can assure you we are currently on track to meet our timeframes for easing restrictions. We are looking for a good result on 15th of October. But things can very quickly change in the world of COVID, as we have seen. And if we don't maintain our COVID-safe behaviours, then this may happen. We need to keep getting tested at the first sign of symptoms. We must actually now stay the course. We have to be vigilant. We must continue to follow these public health directions until the current lockdown restrictions raise on the 15th. I really need us to be in the strongest possible position as we gradually change these public health measures. Really simply, I think what we need to remember moving forward is that we want the lowest possible case numbers we can get and the highest possible vaccination coverage as we move to the next phase of our pathway forward. The better position we put ourselves in at each stage of easing restriction, the better that process and how we will journey forward looks. So thank you for listening to that today. And before I finish up, today I'm giving a shout out to our Year 12 students because they're heading back to on-campus learning today. They've had 2 periods of extended remote learning, and there are heaps of challenges I can only imagine that come with trying to do your final year of high school during a pandemic. I found it hard enough when there was no pandemic, so I can't imagine. Good luck with your final term, students, and I hope it goes well. I'll pass back to the Minister. Thank you.
What's the vaccination rate for public health workers in the ACT? I would have assumed it would have been reasonably high like the rest of the population.
Yes, so at the moment we understand what the vaccination rate is according to a survey of staff, and that is indicating that as of the 1st of October, more than 80% of healthcare workers across the ACT had self-reported as being either partially or fully vaccinated, and 73% fully vaccinated. So that fully vaccinated rate is higher than the population rate, but the partially or fully is not. It is really important to note that this is self-reported data and based on an analysis of the vaccination rates across all of the priority vaccination groups in the broader ACT population, we're actually quite confident that this number is higher. We've, of course, we've set aside previously additional appointments for priority workers and continue to provide a priority phone number for healthcare workers to come forward and get vaccinated. But, of course, now appointments are available whenever they want them. One of the benefits of introducing a mandatory vaccination requirement is that that will provide the opportunity for employers to require staff to tell them, not just to respond to a survey if they choose to do so.
And what's the catalyst for introducing a mandatory vaccination with the cases in the Canberra hospital?
No, I think it's an ongoing risk assessment that, of course, the Australian Health Protection Principal Committee, AHPPC, has been considering as well. So Dr Coleman obviously sits on AHPPC. We've been aware that it was likely that their recommendation would be for mandatory vaccination for healthcare workers. And so we've been working towards that. Most other jurisdictions have already moved down this path. It really is about that assessment of risk associated with the particular settings, not specifically about what we've seen in the ACT. I think that's reflective of the risk that we were already assessing.
Minister, as you mentioned, most healthcare workers seem to be already have a vaccination or plan to get one. In terms of the likely small percentage that are perhaps hesitant or want more information, what work is going on in terms of finalising that mandate to, I guess, support or provide more information to those that are still, I guess, on the fence?
So for those who are ACT public servants, there's also been consultation underway with our unions and industrial representatives around a mandatory vaccination policy that would support any decision to mandate vaccination across the ACT public service, and that does include an opportunity for people to be redeployed if they are unwilling to get vaccinated. There's also an exemption process for those people who are unable to be vaccinated with a COVID-19 vaccine. There are very few reasons that people would be medically unable to get vaccination, but there may be a very small number of people in that category, and then they would be able to receive an exemption for those who choose not to get vaccinated. Within the ACT public service context, there would be redeployment opportunities available, and then it would be up to other employers how they manage that within their workplace as well.
Just a couple of points on that. We can only assume that healthcare workers believe the science and that there must be some other reason that they're not coming forward to be vaccinated. But secondly, how many staff do you anticipate that this could take out of the system, and what impact might that have?
I think it would be incredibly low numbers. So what we saw in aged care, I think, was a really good example of the motivation that it gives people to go and get vaccinated if they haven't quite got around to it. When we introduced the mandate for aged care workers, I think at the time that it was announced or even signed, the aged care worker vaccination rate was around 44%. We saw that double within the space of 3 weeks, and by the time the mandate came into effect on the 17th of September, we had 99% of that workforce vaccinated, and we're now at 100% of that workforce in the ACT effectively fully vaccinated. So I don't believe it is hesitancy. There's probably a range of reasons that people may not have got around to being vaccinated yet. So my expectation is that the impact on workforce will be very small, if any.
Minister, we heard the Chief Health Officer note in some instances that delay of between 10 and 13 days. Do you know exactly how many cases or a ballpark figure, and what do you put that down to?
Look, I don't know how many cases, and Dr Coleman may be able to answer that. Look, one of the things that it might be down to is people being asymptomatic or feeling like, well, you know, it's spring and weather's changing and they've got a bit of a cold, and so they don't think much of it until they get quite unwell. Again, I would just re-emphasise what the Chief Minister said the other day. It is not only in the public health interest for people to get tested if they've got the mildest of symptoms in order to assure themselves that they don't have COVID if they don't, but also if you do, the treatment can be much more effective if it is earlier. So for some people who are vulnerable, there are very effective treatments that can only be given in the first 5 days after symptom onset. So if you wait, you will not be able to access that treatment. So I think it is really important for people to remember that the mildest of symptoms, please go and get tested, and not only for the public health interest, but for your own interest as well. And it's also then peace of mind. I mean, I was not here last Wednesday because I was isolating, awaiting a COVID test. Knowing that you haven't got COVID and you can get on with things is also really good peace of mind for people, I think. So again, and just also a reminder, I know the Chief Minister did this the other day as well, that there are isolation payments available to people if you're going to miss work as a result of having to isolate awaiting your test result.
Just in the wake of the Calvary-Hayden outbreak, has ACT Health Authorities looked at whether there were any issues with personal protective equipment? If so, have any fixes been identified?
I'm not aware that we've identified anything specific in relation to that. We do know that in aged care settings, that very close personal care does create a risk of transmission, and there are some factors around the residents as well. And obviously there was transmission, it appears that there was transmission between residents who share spaces and, common spaces within that one Mary Potter House, where the majority of the cases have been. The Chief Health Officer might be able to provide some additional details, but I'm not aware of any of those things at this point.
We're aware that there's a small group of boarders at Girls Grammar who've got caught up in the cross-border situation. They only received notice on Sunday that they would have to isolate for 2 weeks in their rooms at the school. This is despite a national boarding code that's supposed to solve these situations. Their parents are obviously upset, the girls are upset. Is this a situation that government can resolve?
So I think I'm probably a little bit surprised that people are taken by surprise in relation to this. So the ACT is supportive of the National Code for Boarding School Students and will continue to facilitate the safe return of boarding school students to the ACT. One of the things that drove the National Code was not only return of students to boarding school, but that some jurisdictions are actually, were preventing their own residents from returning from boarding school to their home. The ACT has never done that. We have never stopped ACT residents returning to the ACT, so I think that's an important point to make. The ACT's travel exemption process is only in place for those who've travelled to a COVID-19 affected area, and therefore the code will only be relevant in the ACT for students who are travelling from such an area. The code does not require people to be exempted from quarantine. So travellers entering from the ACT from an affected area do have to undertake 14 days of quarantine at a suitable premises, and that includes boarding school students who are wishing to re-enter the ACT from a COVID-19 affected area, who must apply for an exemption from ACT Health via the online exemption form. And the exemptions team then works with them, each student individually, to ensure that they're able to quarantine safely. Just specifically in relation to Girls Grammar, the team is working closely with the Girls Grammar School to ensure that the girls can quarantine safely, and have provided them with advice around access to courtyards, fresh air, that kind of thing. And the school, I understand, has lots of activities that are planned for the girls to support them through this, and they will be allowed to leave quarantine to do their Year 12 exams.
I think at least one girl is from an area that isn't, an LGA that isn't in lockdown at the moment. Is that the same as being affected?
So the ACT has still, the whole of New South Wales has travel restrictions related to it. So that is our travel requirement. That has been our travel requirement for some weeks now. It shouldn't be a surprise to anybody that is our travel requirement. We certainly recognise that some local government areas have more freedoms than others within New South Wales, but we've also seen recently that local government areas in New South Wales are going back into stay-at-home orders when new cases emerge, and we're seeing new cases emerge across New South Wales on a consistent basis. So our travel arrangements with New South Wales have not changed in recent times.
Minister, just on the changing of the guard in New South Wales, a little bit confirmed today, what impact do you think that'll have, if any, on how ACT and border communities move forward with our health response and reopening?
So I was just watching a little bit of Dominic Perrottet's press conference earlier, and it did seem to indicate that there was no plan to change the current New South Wales roadmap. So I think we're not expecting a lot of change on that front. There are ongoing conversations with the New South Wales Cross-Border Commissioner in relation to the border arrangements between the ACT and New South Wales, and we'll continue to see how that plays out.
Minister, Bali has signalled its intention to welcome international visitors again. Australia's not quite on that list yet, but it's entirely likely that we will be before too long. Do you think it's ironic that we could fly to Bali before we can fly to Brisbane?
Well, I think it's too early to say whether we'll be able to fly to Bali before we can fly to Brisbane. But obviously, I think I would probably be encouraging Australians to travel at home, to travel within Australia. Our tourism industry has been absolutely battered by COVID-19, not just by the lack of international tourists, but by all of the restrictions that have been in place and the shutdowns of non-essential industry over the last 18 months. So I guess my recommendation to Australians would be discover more of your own country before you head off to Bali.
And just to follow up on that, looking at the national vaccination rates state by state, some states, particularly Western Australia, are well behind the benchmark being set here in the ACT. How concerned are you that other states are not lifting their game when it comes to vaccination rollout, because that will impact on reopening Australia's tourism industry?
Look, I think we definitely recognise that the people in the ACT, and indeed in the surrounding region, but particularly Canberrans, have been very enthusiastic about getting vaccinated. That hasn't been the case in some other jurisdictions. And there are a range of challenges for those jurisdictions that have remote areas and a much more geographically dispersed population. That does present additional challenges for the vaccination rollout, combined with a level of hesitancy about AstraZeneca, for example, that we did not see here in the ACT. Our very high, incredibly high, almost 100% vaccination rates of people over the age of 60 would indicate that our hesitancy levels around AstraZeneca were much lower than we've seen in other parts of the country. So I'm certainly not in the business of criticising any of my jurisdictional colleagues around the rollout. Of course, we want everybody to get vaccinated as quickly as possible across Australia. There is now plenty of supply of Pfizer and Moderna vaccines, so I hope that we'll see that increase really quickly in those jurisdictions that are at lower vaccination rates than the ACT.
Given, obviously, you're tightening up the protection in healthcare settings with the mandatory vaccines for workers, would you look at other things such as firming up the guidelines for getting a COVID test for people who perhaps go into hospitals for elective surgery or day surgeries, just because people have reported that those aren't entirely clear? They've been told conflicting information as to whether a test is needed or not.
Okay, so my understanding is that generally speaking, it's not for to go in for surgery, but that's certainly something that is being considered by the Clinical Health Emergency Coordination Centre, is how we look at testing for people who are presenting to health facilities. Obviously, the PCR test is the gold standard of testing, but takes some time to come back. Dr. Coleman's spoken before, though, about the limitations on rapid antigen testing in healthcare settings in particular, where you really want to know an accurate answer. So all of that is still being worked through that clinical health emergency coordination process.
And do you have any updated numbers of people who are using ACT Health quarantine centres in O'Connor and ANU?
I don't have those numbers. The last number I had in relation to O'Connor was around 40 guests there, and I don't have the numbers for ANU at the moment. Chief Health Officer? Brilliant.
Thank you.
Thank you.
Hello, if I could start. You suggested in your address that it's going to be tougher and tougher for contact tracing teams to find the source of all infections when essentially the infection rate takes off. Does that mean that contact tracing as we know it will finish, or how will it be changed?
That's exactly the conversations that are being happened at the moment. We have seen New South Wales and Victoria go to alternate models out of need because their numbers of cases have been so high that they have really had to change their models to focus on those at highest risk. We haven't really had that issue here in the ACT yet, so we're hoping to have a very planned and considered approach. I think the issue about any of those processes that you change, there is a loss of information that you receive, and we don't want to make those changes unless we absolutely have to or we're ready to. And of course, there will come a time when we really don't need all of that information because it won't be important and there's an underlying rate of transmission in the community. So I think this will just take us another couple of weeks to work through. That's why we're really keen also to keep those levels at that really nice stable level that we have at the moment. We just, every single day gives us more information on which to help us make those decisions. I think what the future will hold is a very big focus on our close contacts and our household contacts, and as I've said before, much less focus on our casual contacts, and there will be more about that over the next couple of weeks.
Does that mean potentially casual contacts or the monitor for symptoms as we see it on the exposure site list each day may not need to take the precautions we're taking now?
I think that's what our information and data is definitely confirming, that we are really not seeing transmission from those sites, which is incredibly reassuring. Clearly, though, if there are circumstances where COVID-safe behaviours are not occurring and we get more people movement, there will be transmission at those locations. So this is a balance about saying how do we get on with our lives in a normal COVID-safe manner, but also focusing on what cases do we really need to know about, what contacts do we really need to know about for when they become cases, so we can protect those settings and those people who are much more likely to have those adverse outcomes or those poor health outcomes.
So a trip to Woolies may not take you out for 5 days like it does now.
Well, I would like that, and I absolutely know that the supermarket industry is really keen for us to make some changes. So we have had a really close look at what New South Wales has been doing, and also I understand Victoria is looking closely at that, and if they haven't announced, we'll be talking some of those things through. So I can reassure everyone we are looking at those, and we will be making some changes. We just need a little bit of time to make sure they're done in a way that doesn't make us having go backwards. I don't want to go backwards. We've taken a lot of hits, and we just need to make sure that we can keep moving forwards. So we'll let you know.
Further to that, has any work been done on how isolation rules would work for schools, given Year 12s are back today? If there is a case at a school, would we see an entire school community shut down again, or would you focus on just the classes or year groups? What's the thinking around that?
I think it would be great. Would you like to come work with us? Because they're all the ideas that we're actually looking at. And we're working really closely with New South Wales and Victoria as well, so we can have as much consistent process across for people who travel across those borders as possible. So we've done a lot of work, if you haven't seen the school guidelines that Education have put out, to put in place some practices which will make us easier for us to respond to a case in a school in a way that allows as many students and teachers to continue getting on with what they need to continue getting on with. And some of those measures are what we call cohorting, so trying to keep classes and reduced mingling, so therefore we could just focus on those classes. Obviously, vaccination is one of the really most important things, and we are looking at how we might be able to treat people differently depending on your vaccination status, because that absolutely impacts on your risk of becoming a case if you are a contact, as well as if you become a case, your risk to others. So we're working on it, and we're hoping to do some work with the school community in another week about what it looks like.
Is that a shift in policy from the ACT if you're looking at vaccination status?
I think you're referring to the Chief Minister's comments about vaccination status not impacting on access to services. What I'm talking about is where our public health actions and activities are changing based on vaccination status. So this is about if you are a case, Is there some way that we can treat you based on the risk that you may pose of transmission to others? It's much more likely to be about if you are a contact, how likely are you to become a case and how differently we can treat you. I would not consider that a change in policy at all. This is policy that's set by public health measures and outcomes. Policy for whole of population is what you're referring to, I think.
So do you have a threshold number that you're looking at of number of cases
For
going out of lockdown or not going out of lockdown?
No, I think over the last 18 months we've talked about the complexity of the outbreak, what the complexity of risk looks like. We look at number of cases, but we also look at number of cases which are unlinked, number of cases which aren't in a reduced transmission risk environment. What is becoming increasingly more important is vaccination coverage, and that is pleasingly reducing my anxiety levels quite significantly about being able to progress through our lockdown steps. So there's a whole range of factors that are considered.
Okay, so if we went up to, say, 50 cases a day up until the 15th, that'd be fine.
As I said, I would really like our case numbers to be as low as we can keep them before we progress to the next stage. But, as I've also said, I think the days of teens for our daily numbers are over. We are accepting that our case numbers will be higher than we've seen before. Hopefully, they won't go too over 50 by the time we get to our lockdown step, to the easing of our lockdown step. But I think I've also made a commitment to everybody that I will do everything I can to ensure that lockdown lifts on the 15th of October. My intention is to provide advice to government that we are in a good enough situation that lockdown can ease.
Okay, vaccination projections. When do we hit 70% fully vaxxed and 80% fully vaxxed on the current trajectory?
Yeah, I don't actually have the vaccine projections in front of me, so I can't give you that at the moment, but I'm sure we can provide some more information on that a bit later.
And still on vaccination, Dr. Coleman, do you have any data, over 1,000 cases in total over the outbreak now, any data on how many breakthrough cases there were, or those that were double vaxxed?
If you bear with me, I'll grab my vaccination table and see if I do have that. Because I think we just talked about hospitalised cases, didn't we, from a vaccination status? So from a total cases in this outbreak, which are 1,038, we know that 103 of those have had 2 doses of vaccine. What we don't know and what I can't tell you is how many of those were effectively vaccinated at the time of their exposure, because I suspect that as people have been getting vaccinated as we move through, there is likely to be a proportion within that who could not be considered effectively vaccinated.
What has proven to be the difficulty in identifying those 6 cases who have been in hospital, but you don't know their vaccination status? Is that just because they've gone in hospital recently, or is that simply they haven't told you, or what's the issue there?
I just think it's a matter of timing. Often when we're presenting our numbers of who's in hospital, it will be different people to who I spoke about yesterday, but the number may be the same. So if someone came in yesterday afternoon, we might not have been able to validate their vaccination status, so it's unknown.
Another one. There was a report that there was a positive case in courtroom 1 at the Magistrates Court last Friday afternoon. Is that going to be listed as a public exposure site? And if so, have any court staff or members of the public been requested to get tested and isolate?
Oh, look, I'm sorry, I don't have the detail on that specific case. There's, as you can imagine, there's a lot of cases and a lot of specific situations. But I'm sure if we go through the media guys, we can get you some more information.
Dr. Coleman, could you give us the latest on the outbreak at the Canberra Hospital? How many wards are involved? How many individual patients that seem to have picked it up from that setting? And are you confident that it's been contained?
So I actually might get the Minister to stand back up at the end and speak to that. She is very much across all the hospital situation at the moment. If there's nothing else for me, I'll ask her to address that one. Thank you.
Thank you for coming back, Minister.
No
and just
worries.
wondering if you could give us the latest on the Canberra Hospital outbreak. How many wards have been involved? How many patients And are you confident that that outbreak has been contained?
Yes, so we haven't had any new cases overnight related to either Ward 10A, where we had 3 cases linked, and we've had no additional, and that was quite some time ago now that those cases were notified. In relation to Ward 12B, we've had 1 case linked to that, and that is the staff member working in 12B who tested positive following a household contact exposure. And as far as I'm aware, there haven't been any new cases associated with that. On Ward 14A, there are 2 cases linked to that. So an inpatient on Ward 14A tested positive, and a staff member has now also tested positive. And in the food services, there was, you'll recall, a member of CHS's food services team tested positive for COVID-19, and that also was believe was an exposure from outside of the hospital setting, and there have been no new cases linked with that either at this point in time.
So that's no fresh cases in the last 24 hours to any of those sites?
I believe that's right.
Okay.
Just while this press conference has been happening, Brendan Murphy has said he favoured the release of the health capacity report. Do you believe that it should be released?
I think it was our expectation when it went to National Cabinet that it would be released, and so ACT officials were certainly looking at the data that had been provided by the ACT government to that report, to support that report, to ensure that we were comfortable with that data then if it was publicly released. I think there are some concerns right across jurisdictions about the way that hospital system capacity is framed in that report, and some level of interpretation around the capacity of the hospital system to cope with surges of COVID-19. Of course, our hospital system will cope and manage surges of COVID-19. What I think there is some concern about is the underestimation of the impact across our hospitals and health systems of having to do that in terms of access to other health care, what that could potentially mean if we did see a big surge in cases for things like elective surgery, the capacity of our care at home programs, which obviously New South Wales, Victoria and the ACT are also all undertaking quite significant efforts in caring for people in their own homes with COVID-19. That's why that was one of the asks from the health ministers to Greg Hunt, was to really emphasise that a lot of the care that is being provided in these care at home programs is the kind of care that could be provided from a primary care perspective by general practitioners. Now, general practitioners are busy and can't necessarily do that, but we do believe that the Commonwealth has a responsibility to support that effort, just as they have a responsibility to step in and ensure that if the hospital system demand exceeds that 6.5% cap on growth, that cap is waived, so that we can actually meet that demand and the states not be the ones carrying all the financial burden of that. Just as we believe that it is important that the Commonwealth step forward in helping to address bed block by the fact that we can't quickly and effectively discharge patients who have NDIS plans or who need to go into aged care. So all of those things come into play, but in terms of going back to your question, I think we were expecting that paper would be publicly released. That is our built-in expectation. Okay, thank you.